So I initially started working in Manenberg in 2020. People in the community didn't necessarily want to work with me. They felt that students often come into the communities and conduct their research and then just leave.
Researchers think that the things that they bring to communities is what is important for us. And we say at times it's not important. Come and hear us, come and listen to what we have to say, because we know our communities and what the challenges in our communities are.
We tend to think of communities as places where poor people are gathered and they are vulnerable, and we need to do research in order to help them. Well, that might be true in some sense, but that's ignoring their own agency to find their own solutions, and research can help them find their own solutions, and their participation can strengthen their agency.
So in traditional research, the researcher will identify the research question. Often that is based on reading literature and then identifying a research gap. In community-engaged research, the researcher and the community members will identify a research question together.
So it's a beneficial partnership between the researcher and the community, and at the end of that research process, they are able to work on a plan of action.
I think it can also be considered ethical research because you engage with people, you don't just treat them as objects.
What we appreciated about the current process that we went through with Natasha, from the get-go, she involved us in the research process.
I wanted to make sure that it was almost like a partnership and in collaboration with community members.
The people will be more receptive if you have somebody that doesn't come with the attitude of, I'm the academic and you are the people.
Simply getting a degree or publishing a paper is not benefiting the world, and we want to see research benefit the world. And the best way it benefits the world is if communities are able to use research in ways that reduce their vulnerability, that strengthens their agency, that addresses all those social and economic determinants of health. And that's why we do community engaged research.